So your child has started wetting the bed. Is this normal for this age? Probably yes. If your child is younger than 5, let's talk about what we can do to help them through this normal stage of life. Bedwetting is when your child loses control of their bladder at night. Nighttime dryness is usually the last part of toilet training, so don't be worried if your child doesn't immediately maintain a dry pull-up or underwear at night. Under the age of 5 is normal for developmental stages, and over the age of 5 might be called nocturnal enuresis, if you find they're wetting the bed 2 times a week or more. Nocturnal enuresis may be caused by developmental delay, stress, genetics, bladder, kidney disease, and much more. If you as a parent wet the bed past the age of 5, your child may have the same problem about 40% of the time. Normal bedwetting for your child is usually up to 5 years. The incidence of your child wetting the bed will decrease as they get older, but if your child's still wetting the bed 2 times a week when older than 5, there might be a need for intervention. During the normal age, it's important to only make a big deal out of it if your child does first. If they seem upset, try to include them in the plan for ending this problem. Make sure they understand that it is still normal around the age of 5 and that your child has full support from their parents. Unless they seem upset, just change the sheets and be on your way. The antidiuretic hormone, or ADH, is responsible for signaling the kidneys to stop producing urine. In young children, such as your own, production may not be elevated, and your child may have to use the restroom during the night. They might also not feel the signal as it is not strong in young children. This is what ultimately ends in bedwetting. Talk to your child about avoiding secrecy and developing a trusting relationship with open dialogue so that they feel comfortable discussing these issues with you. Open dialogue helps to decrease embarrassment and tells your child that they always have someone to talk to. Be sure to help your child understand that wetting the bed is not their fault, but a developmental stage. 5-year-olds are growing developmentally through their own needs and actions. Erickson puts them in initiative versus guilt, which means they'll begin to feel guilt when they misbehave or cannot finish their own task. Help these children by giving them activities within their own capabilities, and it's important to promote independence within boundaries. Kohlberg promotes moral development, as these children will learn justice and fairness while exploring ways to satisfy their own needs. Piaget's pre-operational stage is where the child will begin developing social awareness and seeing the view of others. Magical thinking entails the child thinking that their own thoughts can cause outside events to occur. Animism is where the child will begin giving lifelike qualities to an inanimate object. For example, a teddy bear might have feelings or feel pain. Centration is where there's focus only on one aspect instead of other alternatives, and the preschooler will also begin to understand time and daily events related to this. Bedwetting is normal below the age of 5, as developmentally your child may still be increasing their bladder size, producing ADH, and in general gaining full control of their bladder. Some bedwetting may also be from emotional or social problems. These are abnormal instances, and any time after the age of 5 or 6 is also considered to be abnormal. Major life events, such as divorce or the loss of a loved one, can trigger the stress that causes bedwetting. Bedwetting can be decreased by training the bladder, treating stress, and sometimes even certain medications. Desmopressin is a form of vasopressin, which is produced by the kidneys. Vasopressin is produced when the body is trying to conserve water. If you're thinking of trying desmopressin for your child, see your provider about taking this. It's a pill that can be taken an hour before bed for about 3 to 6 months. Use a chart to promote encouraging thoughts that may also be useful in engaging your child with the situation. Like the one pictured here, use stickers or stamps to allow your child to proudly display their accomplishments. It is important not to blame your child, as around the age of 6, your child may feel uncomfortable or even nervous about wetting the bed. Stress can create more problems in deep sleep, and blaming your child for something they cannot currently control may increase the issues regarding their body image. Try limiting fluids around 1 to 2 hours before bed, as bladder control increases with age. Carbonated and caffeinated drinks, such as soda, may also be limited. If the child drinks water, especially in the morning or at lunch, your child should only be able to drink water that quenches their thirst in the evening. Encourage your child to use the restroom before bed, as if they can empty their bladder the best they can, then they probably won't have to during the evening. Using a bedwetting alarm is smart to help train your child to sense the urgency for the restroom. This is a learning process that starts with you usually waking up your own child, but eventually they'll wake themselves up. This normally happens between 6 and 12 weeks of treatment. The alarm will sense moisture and emit a loud beep. Encourage your child, as the beginning process is very hard and it might seem like it's not working. Work with your child. on deciding a day to start, and perform drills to show your child what to expect. Thank you for taking the time to learn about wetting the bed and how to support your own child through this time. Remember that positive thoughts and words work better with your child than negative reinforcement. Make sure you take the time to discuss the concerns that your child might have and create a plan together for moving through this stage of life.